Is the U.S. turning the corner on the COVID pandemic? The signs are pointing increasingly towards yes. Cases are at their lowest levels in nearly a year, and more than 60% of American adults have gotten at least one dose of the vaccine. This weekend, we saw scenes of life getting back to normal with packed crowds for the NBA playoffs and fans swarming Phil Mickelson to congratulate him on an historic PGA Championship win. New York City Mayor Bill de Blasio making a major announcement today on Morning Joe. Major news for the nation's largest school district.
Mika, it's good news. New York City Public Schools, 1 million kids will be back in their classroom in September, all in person, no remote.
But the CDC is now investigating reports that a small number of young vaccine recipients have experienced heart problems after getting their shot. Joining me now is Dr. Kavita Patel. She's a physician and former health policy director in the Obama White House. And Dr. Patel, let's start right there. The CDC says there were relatively few cases that may even be unrelated to the vaccine, and the condition, myocarditis, if I'm pronouncing that right, may be less severe than actually getting COVID. So how concerned should teens and their parents be?
Yeah, Garrett, good to be with you. So I would not be concerned as a parent. What I would say is that this was a good sign that the CDC is being pretty transparent about this. And we also have reports from Israel, as well as some reports when the Department of Defense gave the COVID-19 vaccine to military personnel. And given the fact that we have not seen in other countries which have used Moderna and Pfizer this similar pattern, Garrett, it's hard to make that link. Having said that, I think it's critical for clinicians to be on high alert, physicians and other people such as myself, to make sure that we are reporting any adverse events if this is a true adverse event related to the vaccine. But for parents and even anybody who's kind of not received the vaccine and wondering about it, myocarditis, what we've seen so far is an inflammation of the heart muscle, the muscle that actually kind of helps pump your heart. We see myocarditis after other viral illnesses, Garrett. So that's the part that we need to tease out. Is this really related to the vaccine? Or is this something that we would expect to see normally with cases of myocarditis in young adults? It's mostly young adults, mostly male. And so that means, anybody who sees this pattern should report it to the vaccine adverse event reporting system that the CDC has set up.
Do you think there are any lessons that health officials learned or should learn from the J&J pause and the effects that might have had on public perception of the vaccine? I just wonder if health officials might be more gun shy about potentially hitting the pause button if they find other situations like this.
Yeah, Garrett, that pause button was criticized by many, including myself, because we were concerned about what a pause would send as a signal to people. And I think that what we've learned from J&J, as well as other experiences, AstraZeneca in Europe, is that what we want is to make sure that we do a true investigation of whether there's a cause, kind of a causal link, as we call it. And then two, Garrett, that really it's clinicians. We need to be on high alert so that generally if you see this reaction within several days of a vaccine, you can ask about it quickly. Pediatricians and primary care physicians alike, emergency room physicians and clinical personnel. So I think we have been learning lessons, but let me just reassure people that getting COVID-19, even though cases are dramatically declining, which is good news, is not something that is trivial, no matter what age you are. And so getting the vaccine, still the benefits far outweigh the risks. And we are going to continue to look at these risks very closely, resting assured that, hundreds of millions of people across the world have received these vaccines. And we have seen fewer than about 200 cases, both in the United States and some other countries.
Yeah, that scale is really important. Doctor, we heard from Dr. Fauci on this show, actually, talking to Andrea, that kids under 12 likely won't be vaccinated by September. I know you're a doctor, not a school superintendent, but do you think schools will be ready for that if you've got a largely unvaccinated student population coming back in big numbers?
Yeah, Garrett, you know what? This is one of the first times I can say that health people like myself and schools are working together hand in glove, and that's the way it should be. We are preparing schools of all sizes to be fully in person. Garrett, it is highly likely that kids who are not vaccinated might need to still wear masks indoors. And because we know this is airborne, CDC has updated it and said this is an airborne virus. ventilation matters. So I think we're looking at open windows where possible, outdoor classrooms where possible, and having teachers who are vaccinated and faculty who are vaccinated for the most part will be critical, but also having students take precautions. But Garrett, I'm hoping as we see the viral level of activity decrease like we are now, if that trajectory continues, that means it can be an incredibly safe environment, even for unvaccinated individuals, especially children. I hope that trend continues. This is the first week we've seen the fewest hospitalizations in a 7-day period, about 1,300 hospitalizations. Never thought I would see these numbers, Garrett, by May. So we should hopefully have a bright fall for the kids in school.
Doc, we only have about 15 seconds, but is that viral decline why we're seeing pictures of packed stadiums and things like that, even with vaccination rates only where they are, at about 60%?
Yeah, Garrett, briefly, we're breaking the chain of transmission. We need to get everyone vaccinated. But when you have even 1 out of 2 people vaccinated, it breaks the virus's ability to reproduce. Bottom line, that's helping us get to decreases in cases.